Welcome to NSG 323, Study Session 5, Rhesus Factor, RH Incompatibility. Introduction. There are essentially 4 types of major blood groups in humans: A, B, AB, and O. The rhesus factor is a substance in blood by which human blood may be divided by its presence into Rh positive or Rh negative groups. The final identification of a blood group is thus O positive, B positive, etc. There is some misconception that the same blood group in both partners may be detrimental. This is not true. The actual problem may occur when the mother is Rh negative and the husband is Rh positive, irrespective of their ABO grouping. Therefore, this study session will be discussing the meaning of rhesus factor, how Rh sensitization occurs in a pregnant woman, the signs and symptoms of Rh negative in pregnancy, and lastly, the precautions and general treatment. Learning outcomes. At the end of this study session, you should be able to discuss the meaning of rhesus factor, describe how Rh sensitization occurs in a pregnant woman, enumerate the signs and symptoms of Rh negative in pregnancy, discuss the precautions and general treatment of rhesus factor. Meaning of rhesus factor. Rh negative pregnancy is a pregnancy in which the mother's blood group is Rh negative and the baby's blood group is Rh positive, inherited from the father. Its importance lies in the fact that this difference in the Rh factor can produce complications in the baby. Also known as rhesus incompatibility, rhesus disease. It is one of the causes of hemolytic disease of the newborn, HDN or RHD, hemolytic disease of the newborn. The disease ranges from mild to severe. The rhesus factor is a surface protein found on red blood cells. People who have this factor are said to be Rh positive, while people who do not have this protein are said to be Rh negative. Rh negative pregnancy is a pregnancy in which the mother's blood group is Rh negative and the baby's blood group is Rh positive, inherited from the father. Its importance lies in the fact that this difference in the Rh factor can produce complications in the baby. Also known as rhesus incompatibility. Rhesus disease. It is one of the causes of hemolytic disease of the newborn, HDN or RHD, hemolytic disease of the newborn. The disease ranges from mild to severe. The rhesus factor is a surface protein found on red blood cells. People who have this factor are said to be Rh positive, while people who do not have this protein are said to be Rh negative. Definition of rhesus factor. Rhesus Rh factor is an inherited trait that refers to a specific protein found on the surface of red blood cells. If your blood has the protein, you are Rh positive, the most common Rh factor. If your blood lacks the protein, you are Rh negative. The percentage of people who have the Rh factor is more than those who do not have this factor. In the United States, about 15% of the white population, 5 to 8% of the African American and Hispanic populations, and 1 to 2% of the Asian and Native American populations are Rh negative. The main problem with the Rh factor occurs when the blood of an Rh negative person comes in contact with the blood of an Rh positive person. This can cause the Rh negative person to develop antibodies against the Rh factor. These antibodies never go away and the person is said to be sensitized against the Rh factor. The baby of such a union could be Rh negative or Rh positive. For an Rh negative baby, there will be no problems and no precautions need to be taken. For an Rh positive baby, on the other hand, complications of varying severity may take place. Reasons: mixing of some blood of the baby and mother occurs throughout every pregnancy, but more so at the time of delivery. The mixing of Rh positive blood from the baby, as shown in Figure 1, in a Rh negative mother, causes the mother to build up some negative factors, antibodies, in her blood over time against the Rh positive blood cells. These negative factors may then cross over to the baby through the placenta after birth and destroy the blood cells of the baby. Usually, the first pregnancy is spared, as a few months are needed for the negative factors to be built in the mother's body. In the subsequent pregnancies, Rh positive babies are likely to be affected by the antibodies of the mother. If the mother becomes pregnant with another Rh positive baby, she now has a ready-made supply of anti-Rh. The flow of large amounts of her anti-Rh into the child's blood can cause clumping and destruction of child's RBCs. This condition is called erythroblastosis foetalis. This can result in severe anemia, brain damage, or even death. Such reaction takes place in about 1 in 20 cases of a Rh negative mother and Rh positive father. 5.2. How Rh sensitization occurs in a pregnant woman. If an Rh negative woman becomes pregnant with an Rh positive baby, the baby can inherit the Rh factor from an Rh positive father. The baby's blood enters the mother's blood circulation sometime during the pregnancy, usually at around 28 weeks. The mother's blood cells recognize the foetal cells as foreign and produce anti-Rh antibodies as shown in Figure 2 to destroy the cells. Our blood thus becomes sensitized against the Rh factor. When this sensitized blood carrying the antibodies re-enters the baby, it can attack the baby's blood cells, causing them to break down. This can cause acute problems in the baby. The symptoms are usually more acute in the baby, which follows the first pregnancy, rather than in the baby which has caused the sensitization. The anti-Rh factors have no effect on the mother's cells, but can destroy the fetal red blood cells whenever they come in contact. 5.3. Signs and symptoms of Rh negative pregnancy. Paleness, jaundice, yellow skin and eyes that begins within 24 hours after delivery. Unexplained bruising or blood spots under the skin, tissue swelling, edema, breathing difficulty, seizures, lack of normal movement, poor reflex response. Since it is the baby who is affected, there are no significant signs and symptoms in the mother. Symptoms. Tests may be done to estimate the amount of negative factors in mother's blood. Indirect Coombs test. This gives us an idea of the chances the baby may be affected. The chances of the baby being affected are high. Serial tests of amniotic fluid or blood directly from the baby in the womb are, if the condition is mild, early delivery and treatment of the baby is done after birth. If severe, blood transfusions for the baby need to be carried out in the womb. These procedures are done in selected places by specialists and carry a high complication rate. 5.4. Precaution and general treatment. Precautions. Injections are given both during pregnancy and soon after delivery to prevent an Rh negative mother carrying an Rh positive baby from developing the negative factors. The same injection needs to be given after a miscarriage to neutralize the mixing of blood which occurs in those cases. General treatment. Treatment as explained above essentially depends on the severity of the condition. For severely affected babies, the chance of dying is high. Precautions include early identification of the high-risk pregnancies by checking blood groups with Rh factor for all pregnant women.